guys, welcome back to my channel. If you're new here, my name is Rebecca and I am a stay-at-home mom and an online reseller. And this video is going to be a pregnancy update. It's been several weeks since I've done one. I don't know how long. I feel like, has it been like a month? I don't remember. But this video is going to be, like I said, a pregnancy update. I am now 22 weeks and 1 day along with baby number 3. So this baby is due just before Thanksgiving in 2023, if you're watching this in the future. But she's due, it's a girl, she's due like 2 days before Thanksgiving. So I thought I'd give kind of an update. I didn't like write stuff down like I did with a lot of these videos for updates. I haven't been tracking a ton of stuff, so it's going to be kind of me spouting off things I'm thinking of, and then kind of just like a big overview of what's been going on lately, because a lot has changed. So I just had my 22-week checkup, like prenatal visit yesterday, and that's the first appointment I've had since we had our ultrasound, or anatomy ultrasound, which was, how long ago was that? Was I 20, or I was 19 weeks, I think, which we didn't really see like my actual doctors. It was just like the doctor that was at the ultrasound clinic, which is like the maternal fetal medicine. That's where they send us for our gender, or I always say gender, but our anatomy ultrasounds. So that doctor had spoken to me a little bit, but I hadn't met with my normal practice of OBs and midwives since that scan. My words are not coming out today. But yeah, so I had an appointment yesterday, and it was an OB I hadn't met before because almost all the ones in my practice are new since my last pregnancy. But she was very nice. I really enjoyed her, and she's also pregnant, which is funny. I feel like there's almost always one pregnant like OB or midwife in there. I don't know how like far along she is or anything, but she's pregnant with her second child. So she was very kind, and I think she just kind of gets the whole process a lot since she's going through it right now. But they do all your normal like vitals and everything. So the first thing they did was get a weight on me. I started this pregnancy at 134. I am currently, according to their scales, at 153. So I've gained like a little over 19 pounds. According to Google, I don't know how accurate this is, calculator.net tells me I'm about 4.5 pounds higher than what I should be. I do not care. I don't, like, unless my doctors don't bring it up. So I'm assuming if they bring it up, then there's an issue. If they don't bring it up, there's not an issue. Everyone gains weight differently. Sometimes you gain a lot, and then you don't gain anything for like a couple of weeks, and it's just kind of how it goes sometimes. So I'm definitely not concerned. It's just kind of the way it's going right now, which is totally fine. So I think that was up about 4.5 pounds from my last appointment, or at least from the last time I was weighed. So I think it would have been about a month. So I probably gained like a pound a week or so. Anyway, they say I should gain between 25 and 35. I think I'll be closer to that 35 the way things are going, which is okay. I'm not really worried about it. But yeah, they didn't say anything. So that was my weight. I like to check blood pressure and heart rate, and blood pressure was fine. I think I was like 97/53 or something, which it's always lower in pregnancy, especially like people are different, but for me, mine's always lower. It's not a concern because I'm not having any like symptoms that are related to low blood pressure. My heart rate was, I don't know, 70 something. Totally fine. Mine does not do any kind of like urinalysis. They don't do like pee in the cup thing anymore, because they said they actually stopped doing that towards the end of my last pregnancy. And they said whatever governing bodies they follow basically said it wasn't needed, or it's not as accurate unless you're having symptoms. I don't know. So they don't do that. They don't check for the protein in your urine every time, I guess, unless they have concerns for you. So they didn't need to do that. So I did bring up a couple concerns with her. So the first thing was, at my last appointment, they had told me that, I think I forgot to bring this up in my last update, but they had told me, I saw my midwife at the last appointment, and she had said that it looked like I had an umbilical hernia. And she said it's not really a big deal. It's pretty common in pregnancy. They won't do anything about it while I'm pregnant, but it needs to be assessed after I deliver, and sometimes it requires surgery. So this OB said pretty much everybody who has an outie belly button during pregnancy has like an umbilical hernia. So I guess it's nothing to be concerned about right now. It's just something to, like, if I have issues with it later down the road after I deliver, then it's something to address. It's just like, you can see when, if you're familiar with like coning for diastasis recti or recti, however you want to say it, or diastasis recti, there's so many ways I've heard it pronounced. But when your abs separate during pregnancy, which I had last time, and I'm pretty sure I have it already this time, but you're not supposed to do things like crunches and sit-ups because your stomach will kind of cone instead of staying rounded, like cones. So you can definitely tell my stomach looks coned and kind of like wonky when I do stuff like that, which you're not supposed to do, but that happens. So it's not really a big deal, nothing to be concerned about. The other things, so 2 big things that are going on right now. So the one is that I have SPD, which is, let me make sure I say this right, symphysis pubis dysfunction. It's also called pelvic girdle pain, so PGP, pelvic girdle pain, yeah. It happens in about like a third of pregnant women, and it happened to me in my last pregnancy, but it happened much later, like much closer to delivery, and it wasn't that severe. But basically, here's a little anatomy lesson. One of the big differences in male and female anatomy is that males have like a pelvis that doesn't move, right? Nothing needs to move in their pelvis. But ours is made of like 2 different bones that's made to separate so you can birth a baby. And because the ligaments and everything that hold it together loosen during pregnancy, all of those fun things, it can cause pain. So I've been having a lot of pain, literally like right on my pubic bone area and in my groin area. I get it from doing things like lifting. I've got 2 children, a 2-year-old and 4-year-old, so I'm lifting a lot. Lifting, walking, squatting. Especially I'm noticing when I'm walking a lot in my house, because you know when you're like even in your kitchen or whatever and you have to turn to do something, you probably don't realize it, but your one leg kind of turns before your other one joins it. And that causes a lot of pain. I had a lot of trouble walking yesterday. Today, same thing. It's very painful. And it's already common, like in pregnancy, that around this time, you need to make sure when you're getting in and out of a car, in and out of bed, that you're moving your legs together instead of like separately, because things need to stay together, because that can cause that kind of pain. So I was already expecting that, and I experienced that first, and then it got worse. And now having pain walking, I've literally seen it where it can get so extreme that some people are like put in a wheelchair because they can't walk. So I described this to my doctor, and she immediately was like, I'm putting in a referral for physical therapy for you. So I'm waiting for a call from them to schedule physical therapy appointments. I do see a chiropractor already. I actually have an appointment today that will be going to her, and she does like specialize also in pregnancy. I've only been to her once so far this pregnancy, so I didn't have SPD the first time. We'll see what she says today about anything she can do to help with that. But I will be doing some kind of physical therapy. I don't know if it's pelvic floor therapy, which I did after I had my last baby. I went to pelvic floor therapy for other reasons. So I don't know if it's that therapist or if it's a different kind of therapist. I don't really know anything about it. I don't know how often I'll have to go or what they'll do or anything like that. But she said I need to get into physical therapy like right now, because I'm just like, I can't not walk for the next 18 weeks. Like, I can't be in pain walking daily for the next 18 weeks. Like, that would be awful. So hoping we can help relieve some of those symptoms. That was one of the big things I was discussing with her. The other thing is that at my ultrasound, I technically am considered a high-risk pregnancy now, because I have what is described in the notes. If you look at the notes, it says I have placenta previa, which typically means like here's your cervix, your cervical opening, and your placenta is covering it. So a baby can't be birthed through a placenta. Like that doesn't work. You'd have to have a C-section. So that's what it says in my notes. It says that's what I have. But when they described it to me after I had my ultrasound, they said my placenta is actually sitting like right at the edge. It's not technically covering it. It's just like right at the edge. So I'm kind of like borderline placenta previa at this point. And they said oftentimes these can resolve themselves because when your placenta is attached, I'm not very good at showing this. If this is your uterine wall, here's your cervix down here. If your placenta is here, as your uterus grows, like it should naturally bring that placenta away from the cervical opening, just from growth. And the placenta isn't completely like cemented in there. It can, I guess, migrate a little bit on its own, not like a ton, but so it can do that. So that gave me hope that I have enough time. I'm only 22 weeks, that it will move out of the way and I won't have to have a C-section, because I really don't want to have a C-section for that. But you know, you can't control these things. I will have another ultrasound at 32 weeks, and that is when they will check again to see if it's moved out of the way. I don't exactly know the margins. They didn't say what the margins are of like how far away it has to be for it to be safe for delivery, so I don't know. And with that, it's just like I really have to watch and make sure, like if I have any bleeding, I have to go to the ER, because that could be like a ruptured placenta, which would not be good, because that could cause me and the baby to essentially bleed out if it's not treated. But I haven't had any issues like that. I'm also on pelvic rest, so basically nothing penetrating can happen in that area, which is fine. It's just the way it is. But yeah, so my only concern though is that my placenta is posterior, which I had with my first baby. My second baby was anterior. So posterior just means it's on like the back side of my uterus. Anterior would be if it's on the front side of my uterus. So it's on the back side, and my assumption is because you typically grow forward and outwards, your uterus does, they said that the posterior placentas typically don't move as much, so it might not move out of the way, which is not great. I'm hoping it still does, but we don't know. We'll just have to wait another like 10 weeks until the next ultrasound to find out. But other than that, I don't need like any extra checks or anything. I did ask her, I said, if it doesn't move and I do need to have a C-section, when can I expect the C-section to be? Like, how early do you do that? So when I was in the appointment, she said 39 weeks. And I was like, okay, I mean, that's nice. It's only a week early from my due date, but that seems like cutting it pretty close, especially for like my third baby. I was like kind of surprised that they would cut it that close, because like, what if you went into labor naturally and started to try to, you know, your baby tried to come out through your placenta? That could be fatal. So I was kind of surprised by that, but I was like, okay. But then she sent me a message later. So, you know, things happen. People, I don't know, things happen, right? They're humans too. Doctors are humans too. So she sent me a message later and was like, she was mistaken. She said, no, if it doesn't move out of the way, I would have to have a C-section between 36 weeks and 0 days and 37 weeks and 6 days. So I would have to deliver essentially 2 to 4 weeks early. And that makes me a little like, oh gosh, okay. Like, that's kind of what I'm looking for, because I want to know what is the earliest that this baby could be born. She said usually they don't do the earlier end of that unless there is like already some bleeding or complications that would cause you to need to deliver that early. But I'm already like, I'm not worried at this point, but just thinking through the things that could happen. So it's like, okay, so if we deliver earlier, my parents are typically the people who watch for my kids. They're going to be in Tennessee and we're in Pennsylvania. So they're going to be in Tennessee on a vacation in early November. So there kind of goes our child care, unless they're able to like come back, which I would hate to do to them, but that could happen. I don't want a C-section in the first place. Nobody wants a C-section. I don't say nobody. Most people don't want a C-section. I don't want to have to deal with a surgery, the recovery, the scars, just the whole experience. Like, I was really happy with my last birth, having done an unmedicated birth. It was a very healing birth, so I'd kind of hate to go out on a C-section after like I finally got the kind of birth and being like, I feel like I know how to do it this time. But we don't know. We have no idea what's going to happen with that. But there's a good chance that could mean a NICU stay for the baby. And then it's like, my husband, I think, is only going to have like 2 weeks that aren't even paid because he switched jobs. So it's just him taking 2 weeks off of work, essentially, to stay home, help take care of the kids while I recover. So if I have a C-section, or the baby's in a NICU, that's going to complicate things. And I'm also probably going to try to pick up maybe a couple preemie like sleepers while I'm thrifting. I have a ton of baby clothes. Where's my box? I can't feel it. Right there. Whole bunch of baby clothes in there. I just recorded a video about all my thrifted baby clothes, but I always just get newborn and above because that's what my kids have always worn. But I'm like, I might want to pick up a couple preemie outfits in case things go that direction. So while I'm not like worried and fretting over it because there's nothing we can do and we still have like 10 weeks until we even find out if the placenta is moving or not, it's just kind of like like really, like, come on, I hope we don't have to like go through all that. So, I don't really have a whole lot of other updates. Everybody knows the gender of our baby. We have a name picked, but we haven't shared it yet. Not even like with friends and family, we haven't shared it yet. So I don't know, my husband's being weird about that. I'm fine, ready to share it, but he's not. So we'll see whenever that gets shared. But yeah, I don't have much other updates. I almost forgot to show you my bump date. So I'm in my bedroom because I'm trying to stay away from the loud kids. So let me see if I can turn my camera enough that you can see a belly shot. Oh, it's going to be difficult. This isn't the best angle ever, but this is basically my 22-week belly. I don't feel like huge compared to like how big I know it's going to get, but you know, I don't feel small. I've seen some updates where people are much smaller, but I think it's because they're not maybe on their third baby. And everybody's body carries babies differently. So baby's definitely in there. Baby's super active. And yeah, that's my 22-week update. So if you have gone through Placenta Previa, either way, how it turned out, let me know in the comments. I would love to hear some other stories, both like whether you ended up with a C-section because it didn't move or whether it did move and you were able to have a vaginal delivery. I would love to know either way. But if you did enjoy this video, then please hit the like button and subscribe to come back for more baby, mom life, and reselling content. It's a little bit of everything on this channel. And I hope you enjoyed this video. You can check me out over on Instagram. I'm at TheCozyShire, and I have updates occasionally over there. Life has just been really crazy lately, so I'm a little intermittent on things. It's not like a set schedule of anything right now, but I hope that you enjoyed this update, and I'll see you guys in the next one.